So firstly, just looking at what is a clinical nurse specialist. So we are nurses that are experienced with specialist knowledge of the cancer types and also the treatments. You might meet different CNSs throughout the pathway. Sometimes you will meet the surgical nurses, a diagnosis, and then if you're moving through the pathway over to oncology, then you will meet the other CNSs there as well. So I work alongside the oncology pathway, supporting patients that are going through chemotherapy and radiotherapy. We work closely within the whole team and work closely with the consultants. We're your key worker, so we're there to support you from the start, from diagnosis and through treatment and beyond. And we can offer that continuity of care because we're someone that you can see at multiple points throughout the journey as well. And so we become your key point of contact for various different things. So what we're there doing, we're helping, supporting you through the diagnosis, talking through treatments and what can happen next. We can help provide you with extra information about your cancer type and the treatment and go through that a little bit more in depth with you. We help to provide education and support on either treatment side effects or also helping with symptom control as well. We're there to support you and also your family as well, both physically and emotionally. And we help to coordinate your care. We can be the bit of a go-between. There's patients that are referred for surgery or referred to other services. We're quite often there chasing in the background, trying to make sure that's as seamless as we can. We can also conduct clinical assessments. A lot of clinical nurse specialists do their own on-treatment review clinics or follow-up clinics as well. And if we've got any concerns or you have concerns, then we can always liaise back with your consultant and get you back in for clinical appointments and review with the team. As I said, we refer to further services. That might be Macmillan for support, and it could be for if you've got other side effects, things like lymphedema, district nurse referrals. There's a whole multitude of referrals that we do. And we're there to advocate for our patients. We get to know our patients quite well along the pathway and can be that voice for them sometimes if either they're not present at a meeting and then we're discussing about their care, or if we know they've spoken to the nurse and we know that there are certain things they want to ask but they haven't felt they've been able to ask yet. And we're just there to try and help navigate that journey. It's an overwhelming journey with lots of different people involved, so just trying to be there and again, that continuity and that familiar face. So how often do you see us? I mean, quite often, should be throughout the journey. We'll always try to be there at your first appointment where you're meeting your consultant or oncologist, and that's where we would give you our contact details as well, so that if you have any further questions following that you can come back to us. We see patients for either pre-assessment clinic, for patients that are going to be starting chemotherapy. So we'll meet again there where we talk through all the side effects of treatment, who to call and what to expect. We're there alongside review clinics. I say some nurse specialists do their own review clinics and then others will be present at the consultant reviews. We always try to see patients throughout treatment. If there's patients that are in for chemotherapy, I especially always try and see patients on their very first cycle, just to be that familiar face and that little bit of support there as well. But ad hoc, we'll just try and see patients if they're in the Arden Centre as much as we can. Trying to be present at outpatient appointments. So for ourselves at the Arden Centre, I work with 4 different oncologists and they all do clinics on a Friday morning all together. So it's really hard, I can't see all of the patients there. But I do try and get in as much as possible so that patients can see us. Sometimes they think if a nurse specialist is present, then it could be that there's some bad news that's going to be broken. So we're trying to move away from that and just be that familiar face that's there, not just for bad news, but just to see how you're getting on as well. And again, when further support is needed, we are quite often called to clinics if there is further news to be said, or there's going to be changes in treatment, just so that we can give any ongoing support if needed. If patients are admitted to the ward, then we'll also try to see you there. Sometimes it just depends on our workload at the moment, at that time, but again, we will try and get to the patients on the ward as well, just again for a little bit more support, or if we can help speed up whatever's going on the ward. But importantly, you can always reach out to us at any stage, whether that's a phone call or you're within the hospital and you wanted one of the CNS team to come and see you as well. So we're there to try and help you understand your care and what's happening. As I said, explaining your cancer. When you have new patient appointments with consultants, the amount of information that can be given is huge, and we can sit and we can see that patients just suddenly, it's not being taken in anymore. You can just see that's happening. So quite often we might, if we pick up on that, or the patient wants to sit with you a little bit after as well and just try and discuss that a little bit further with you and answer any more questions you've got. Trying to help you understand the treatment options. Sometimes consultants actually may offer, there might be multiple choices for treatment options, and that decision is also given to the patient. So talking through that as well, trying to answer questions so that you can make an informed decision as well. Helping you understand what's going to come next, whether it's for treatment, how does that work? Or if it's not treatment, what's the follow-up look like? What do you expect might be happening next? And when to contact and who to contact. Another important one for our sales patients on treatment, if they're unwell, have to contact acute oncology. As much as the CNS team can support, quite often we're in clinics, on ward or something, and we don't always get to our phone particularly quick, so if patients are unwell, it's acute oncology, because they're there 24/7 supporting anyone that's unwell. When queries are relevant for the CNS team to pick up, or actually maybe more appropriate for GPs or community team, again just trying to help you navigate who is the best person to go to. And discussing queries, whether that's queries that we've got, if we've spoken to you and we're concerned, we can go back to the oncologists, or if you've got questions for your oncologist and you're not going to see them for another month or so, but there's something that you want to check first, and again we get lots of questions like that. And just helping coordinate that care throughout the wider team. We tend to just be your key point of contact to go and find out all those other answers for you. So we're here to offer support as well, and as I've said, that can be to patients or it can be to their family members too. Emotional support, so talking through any fears or worries that you do have, referring as well forwards. There are support groups, charity groups, and then we have psychology referrals that we can also do. Or sometimes just having a chat with your CNS might be enough just to cover any concerns that you've got. Talking through physical support as well, the side effects of treatment, and if you may have symptoms of the cancer itself. So talking through any of those side effects or symptoms that are following treatment, they might be from treatment, that are just lasting longer. Practical support, so we quite often refer for people that needs financial support to the Citizens Advice Bureau, or helping managing more at home. That might be occupational therapy. As I said, we refer and signpost to quite a lot of different services, including the Look Good Feel Better service as well. We're there to support you after treatment's finished. A lot of people, I think, whilst on treatment, it's very busy, and we see people a lot. They have a lot of contact, and then once you might be in a period of follow-up or on maintenance where you're not seen as often, sometimes people feel a little bit more alone then and a bit more worried. So understanding that we're still there, even if you're not on treatment at the moment, your CNS is still there, happy to support you. So we also offer doing what's called a holistic needs assessment, and we can do this, it's either called a HNA or we might call it an EHNA, you might hear it referred to as that, which is just done electronically. And this is an assessment, it's like a tick box that you can go through, and we offer that at different points throughout the care. Quite often it's done at the start, at the middle or the end of treatment, or if there are any changes or a point where you think there's something new that I'm worried about and I'm not sure where to go. It covers the person as a whole, like a holistic approach. So that's covering your physical health, emotional, financial, relationships and sexual health, spiritual, religious support. As I said, it's a checklist, which I've got on here. You can see that. So it's just looking at all the different areas that you could be finding hard or you're concerned about. And then what we'll ask patients to do is tick off the ones that are the most concerning to them. And then we'll go through the top few that are causing the most immediate concerns and work through it. I mean, if it's physical concerns, it might be something we can help with different medications. And again, as I said, we do financial referrals, just looking at the person as a whole. And at any point, we can look at doing these. We're often asked about how to prepare yourself for appointments. So writing things down, I think when you get in front of your team or the consultant, things that might have been burning questions at home suddenly go out of your head, or the doctor says something and that throws you completely, and you leave thinking, I didn't actually ask many of the things that I wanted to. So always write it down, any questions or concerns. If you're coming for a review for treatments, make a note of any symptoms or side effects that you've had along the way. Bringing someone with you is always really helpful if you can. A second pair of ears is always good. Again, sometimes you hear something and then you don't hear any further after that, so somebody else to listen in is really good. And when we talk about the pre-chemotherapy talks, it's huge what we go through, all the side effects, and it's very daunting. It's daunting to deliver, let alone be on the other side listening to all the potential side effects. So again, having someone else there that can help take it in if possible. Always bring lists of medications or changes to medications. We quite often will know what changes there has been, but if you've seen the GP, they might have changed something that we're not aware of. Clothing, people aren't always sure what to wear if they're coming for treatment or just coming for a follow-up appointment, but something comfortable. We may, if on that day, think you might have said you've been feeling unwell, we want to check your blood pressure, so just we can access your arms, do blood pressure, do bloods if we needed to. On first appointments, sometimes there can be examinations as well. Usually just abdominal examinations, again, just some comfortable clothing, and be prepared that sometimes there might be a need to examine, depending on any concerns that you've raised. Always feel that you can ask questions. If at the point you didn't want to ask it in the clinic, then you can always again ask the nurse afterwards. We're happy to go back and ask further questions for you. Always ask if you need things to be repeated. Ask if you can have a clinic letter. It can be really helpful to just have that all on paper afterwards as well. And making sure you've got contact numbers if you've lost our numbers or the numbers for anybody else within the team. Always making sure that you've got those there as well. And as I said earlier, we might see you after your consultant appointments as well, or you might ask, can we just have a little bit of time with you afterwards? Again, if we picked up in clinic that maybe there's a little bit more support or advice we need to give there, or if there's something that you wanted to ask us anyway. So we do a lot of talking about preparing for treatments. As I said, we do the pre-chemotherapy assessments. And it is a big in-depth discussion. We'll try and make sure you're as prepared and understanding what's going to come next. We talk through the side effects, what the risks are, who the emergency contacts are and when you would need to use those, and looking after yourself on treatment as well. We'll try and answer any questions or concerns that you have and just discuss the logistics of what a day would look like as well, how long you might spend in the unit, and just preparing how long you could be there. And making sure again that you understand what would be the next steps following on, and importantly who to contact when you need to. So reasons to contact us. It could just be you've got, say, questions after clinic appointments that you weren't quite sure about. You've got some side effects, you've got some new symptoms, you've got something you're unsure what it's relating to. You're always free to call us and have a chat through it. If there's something you don't understand about your care, or as I say, sometimes the consultants might have given you a decision to make and you want just a little bit more support around making that decision. Supporting you emotionally and physically as well. Whether we get lots of queries at our appointments, blood tests, when's my next CT scan going to be, or I haven't had one, an appointment through, can we chase it up? Pretty much if you're just not sure who to ask, then you're welcome to come through the nurses for us to find out. And I did add on there about just remembering that we're not an emergency line. Sometimes we do have calls that were better directed to the more emergency, like acute oncology or something as well. But we always try and make that very clear what's the appropriate reasons to be calling us. So contacting us, hopefully your CNS would have made that clear when you first meet them, how is best to contact them. Different centres probably have different ways. We don't have a mobile, I have a landline and a bleep. But I know other trusts will have mobiles that you can get in touch with, sometimes email. With our number, I always say, well, please always leave a message. We're quite often not sat at our desks. We will get back to you that day unless it was left to, after working hours. And I always make sure that our answer phone is clear, again, stating that who's the acute oncology number if you needed to have any, to talk to somebody urgently. You can also ask to see the nurses when you're just in the Arden Centre. Quite often we'll get a bleep just that somebody's in for another reason, but they wouldn't mind seeing us for something. Obviously down to capacity of our workload that day, of how much time we've got to just come away. But it's also always fine if you're there already anyway. And then other members of the team, they can also help you contact us. The chemotherapy suite, radiotherapy, switchboard, all of them are able to put you through to the nurse specialists as well. So key points to remember is that you should always have a named nurse that is there supporting you. At the Arden Centre, there's myself and another nurse that's working with me. We're not expecting you to go through all of this on your own. We are there to help. Feedback always welcome. We're always trying to improve services. So if people feel that there's something we could do, and I think your best place, if you're using that service, you're going to notice things that could be highlighted or improved. No questions are too small. There are no silly questions. If we don't know it, we don't know it. So it's always good to ask. And I know I've asked consultants many questions that I think, oh God, they're going to laugh at me for asking this, but if I don't know, I'm going to do it anyway. And a big one, patients don't always, but often say, I know you're busy and I don't want to bother you. But that's exactly why we're here. We are there to support you, and it isn't bothering us. We're not too busy to help, and it's not, if it's a concern to you, and you might think, well, maybe that's too trivial to ask them. If it's on your mind and it's worrying you, it's important to you. And if we can help make that better, then we are going to try.